Good afternoon. Thank you for visiting Macarthur Women's Health Centre yet again. Very grateful to have your support. Community-based women's health centres like Macarthur Women's Health Centre are often lifelines for women facing barriers to healthcare. Why should governments prioritise sustained funding and expansion of these local grassroots services as Macarthur Women's Health Centre?
Well, because there's not too many more important things a government should do than support some of the most marginalised members of our community. And I think arguably women who are seeking critical and essential services, many of them escaping very violent homes, terrible circumstances, family units broken down, they need our support. They need government support. So in short, supporting those who are not in a position to support themselves is a fundamental priority for any government of any persuasion.
That's a very well-rounded answer. It's not new to you to support this centre. You recently supported this centre with $15,000 to improve our facilities, so we're very grateful for that. What does this investment say about your commitment to safe, accessible spaces where women can connect, build knowledge and access critical support services, and what more needs to be done?
Well, I'll always support the centre. Why? Because you support women in our region and our community when they need support at a very serious and desperate time and chapter in their lives. That $15,000 is in addition to a number of grants, but I want to be really clear. I want to give credit to the centre, to the women involved who support, the clients who rely on this service. I just see it about them. I see any investment of taxpayers' money, it's not mine, it's the taxpayers' money, being an investment in the future of these women. Not only in many cases changing the course of their lives, I think in many cases it's saving their lives. So that, I think, is a very worthy investment and something I'll always support.
Thank you for that. And we've had a little bit of a look of what that $15,000 meant for us. It actually created a new room where more practitioners can do the excellent work that the staff of the centre do. So thank you.
Thank you for having me here. Seeing what that investment has provided for the centre to support your clients in more and better ways really warms my heart.
Many women still face stigma, cost or access barriers when seeking support in the general healthcare system. What is your message to women in Macarthur community about their right to access services like our services, and how will you help ensure no one's left behind?
Well, thanks to Macarthur Women's Health Services and many other services across New South Wales, these women should never be alone. Obviously, like you have clients, they're local residents that I'm privileged to serve. They come and talk to me in my office, and I think one of the biggest barriers and challenges that women have when they're escaping a violent home, when they're escaping an unsafe workplace, whether they're being financially controlled through coercive control, or the many other tragic and disgusting forms that these perpetrators attack their victims with. They should never feel alone. That said, I'm not going to pretend to imagine to be one of those victims, one of those women, because I'm not and I never will be. But what I can do is everything I can to support you and Macarthur Women's Health Services, because that by extension supports them. My message to them is please find that courage, because wonderful organisations like Macarthur Women Health Services are here to support you, along with many other support services in and around our region. And if you don't know where to go, give my office a call, 4625 3344, and we can point you in the right direction.
I think that's very, very well said. Thank you for that.
Women's health outcomes are deeply shaped by social and economic factors. Why is it essential for government to work in genuine partnership with community organisations to deliver equitable community-led solutions?
it is those community organisations that are on the front line of servicing those, in many cases victims, but at the very best, most marginalised people in our community. And you would know better than me, some of the most marginalised in our communities are women escaping a broken family unit or a very tragic and violent or coercively controlled relationship. My findings, and I'm privileged to serve a lot of people in my electorate, of course, many of them women, and a lot of people very sadly, but thankfully as well, come to me in a time of need because they're not sure where to go. So they tell me or my wonderful staff their message and we point them in the right direction. The short answer is that's the role of government, and that's why we must support organisations that support the most marginalised in our communities.
Thank you so much for having that attitude. We're very grateful to have an MP in our area who understands the work that we do so well. I think Campbelltown is very blessed to have you as an MP, Greg Warren.
Well, to serve our community in the New South Wales Parliament, second only being a father. Yes. I mean, there's not too many more humbling and proud things than to have tens of thousands of people put their faith and trust in you to represent them and fight for them in the best way you can. You can't do everything all the time, but you can always do your best, and that's what I try to do.
Best, and you're an advocate, and we're very happy about that. Thank you very much. Services like Macarthur Women's Health Centre rely on strong community backing. What responsibility do other leaders, organisations and community members have when they actively support and advocate for women's health services? And why does that matter more than ever now in the world as it is?
Well, don't we? We live in a very uncertain world with so many different moving parts. And I think if you break that down to a local perspective, that brings hardship into people's lives. That brings financial pressure. That brings other pressures that ultimately impacts the family unit, which tragically sees more victims. It activates perpetrators. And why should other community leaders support centres like yours and Macarthur Women's Health Centre? Because you guys are the ones there caring for them, those people that do fall through the cracks. You're the ones where people come to and who people turn to help them when they can't help themselves. So as community leaders, we must really consider and reflect on where we are at in society, whether it be socially or economically. Use what we can to support places like the Centre and other organisations. Use our influence, use our position, do whatever we can. Because at the end of the day, I think if we all work together, that's when the best outcomes will be achieved.
100%. If we all work together, we'll get things done. I think that's the importance of having people in the community supporting each other and making this stuff work. Humans are not meant to be alone, you know. We're supposed to be doing things as a collective, as together. And I think, yeah, I agree with you on that point. Thank you so much. Greg Warren, thank you so much for meeting with us today. We are so grateful to have you as MP for Campbelltown, and we appreciate the support that you have given this service and that you continue to give this service. Thank you so much.
Thank you so much. The privilege is all mine. Being in a position to support many organisations, particularly Macarthur Women's Health Centre, is a privilege that I never take for granted. Thank you for having me.